Hi YouTube, it's me again. I just wanted to continue on from my part one post-op video to just explain how the rest of my day went after surgery and also my day one post-op. Now, as you can see, I've just taken my strap off just to give you a little bit of a look-see. So you can see that they are actually sitting quite high, but not, right up to my collarbones or anything like that. They're not, massively swollen. They still look quite natural. Um, and I'll just, you can see that my old creases are here. Down a little bit for you. And my new crease will be here. So I do have, basically this here needs to drop down quite a bit. For them to sit nicely. So hence the strap needs to push them right down. There was about that much difference in the position of crease. On this side especially, there wasn't much skin at all to really work with. So I may end up having a little bit of a flat spot. But it will only be noticeable for somebody who's looking down directly underneath. Now, I also wanted to show you my incisions. You can see, sorry, it's really hard when you're doing mirror image, that there's just a tiny bit of blood there, and that was from the day of the surgery. I haven't had any more bleeding come through there, but you can see I'm starting to get a little bit of bruising. I am a little bit more sore underneath compared to most people because he did have to deepen my pocket down to make room for my new crease. I'll just show you the bra that I was that I went home in. Let me just zip it up here for you a little bit. So it looks something like this, and it's zipped up in the front. And of course, the dreaded strap that everyone goes on about. It's not as bad as I thought. I guess I just had, I expected the worst with it, but I actually completely understand the use for it, so I do appreciate it, especially with, my body shape, that I do need to really push the old creases out to become a new round shape. So yeah, I came home in that. Now the reason I'm wearing a new one is yesterday I could just feel that there was such a gap here, and it wasn't supporting my incisions very well, and it just felt really big, and there was quite a bit of gap here. So I stepped into this one and pulled it up fairly easily, and it just straight away just felt like, sorry about the groping, it happens when you get your boobs done, but it just felt like the right fit, and it also helped with my strap to be a bit more comfortable. Okay, sorry, moving on. So when I got home from surgery into our apartment, which was fantastic, by the way, so if you are traveling for a breast augmentation, do your research, make sure you find an apartment that's really close to the hospital or the day surgery that you will be getting the surgery done. And make sure it's got, like a balcony that you can sit out on, a really good couch that you can sit on, a DVD player. We bought some DVDs to watch as well, although we probably only watched maybe one or two. I snoozed in the afternoon. I didn't so much as sleep all day like you would coming out of a general anesthetic. When I felt myself like falling into a bit of a dead sleep, I would actually get up, and I went and made myself a cup of peppermint tea to keep my stomach settled just in case. And also, it was caffeine free, but it just made me feel really refreshed and revitalized. My partner stayed with me until that afternoon. I would get up, go to the toilet myself, get myself a drink. The medication I took was just 2 Panadol and half a Valium every 4 hours. I found the Valium to be perfect for me because I went dual plane, so most of the pain that you do get is from spasms from your muscles contracting because there's something foreign in there. Sorry, I'm just a little bit itchy where the incisions are. And then I just felt that the Panadol was just gentle enough to ward off the edge of the pain. Dr. Harwood gives you a 12-hour local anesthetic in the area, so you do go home pain free, but it does slowly wear off. You're not, all of a sudden in no pain, and then all of a sudden you're like, oh my God, this is so bad. It slowly wears off, so you get used to it quite well. I'm a complete wuss, but I don't know if my pain threshold is quite well, or I just have had such a great experience. But it was definitely a discomfort rather than, oh my God, I'm in so much pain, I wish it would stop. I was actually surprised and really happy at how painless, not painless, but the degree of pain was quite low to what I had been expecting. After I had a little snooze in the afternoon, I woke up and I went and sat outside. Just took the Panadol and the half of Valium on the dot like clockwork. I went upstairs to the bedroom and washed my face and put some makeup on, combed my hair, put some dry shampoo in, just made myself look normal so I could feel normal. I think that really helps. I just put a hoodie on and some tights, and me and my partner went out to visit his family, and me and my cousin went to get pizza capers around the corner. Prior to that, I'd picked out a chicken and salad sandwich. Not because I wasn't hungry, I just thought, I would slowly get back into eating as to not upset my stomach, and I think that was quite wise. At no point did I feel nauseous at all. I got a small pizza capers pizza, and I probably ate 2 pieces of that. And that's when I took my first antibiotic, which I was a little bit hesitant about because in the past they have made me sick in the stomach. Just in case, I took another anti-nausea, which I knew would have worn off by then as well. Just as a backup, I probably wouldn't have felt sick anyway, but I just wanted to do it just in case. There's no point, trying to be tough. I just took it and I did really well. I stayed awake till about 8 o'clock, and then I'd been trying so hard to, sort of not sleep all day so that I could sleep through the night. And I probably had about a 2 hour nap from 8 to 10. Then I woke up and my partner was back home, and him and my cousin were just looking at me, and it was really weird. It was a little bit creepy. And then we watched a movie, and I probably went to bed at about 12. I took some painkillers again right on the dot, and I think the next time I was supposed to take painkillers would have been at 2:30 in the morning. And I woke up at 2:30 in the morning, not because of pain. I think my body just knew. I didn't feel like I was in much pain, but I had everything next to me, and I just tapped my partner and got him to sort of push me up. That's really the only help I've needed, is to get, from a 45-degree angle upwards. My abs are killing me. That's probably the most pain that I've had, which is good because they're getting work out. And he just helped me up. and I took my Panadol and half a Valium and went back to sleep and slept till 6 o'clock. In the morning, I was really excited. I got up. Now for morning boob, I've got a fantastic tip. As soon as you wake up in the morning, take your strap off, then get yourself up really slowly and then stay there for a minute or two. Let the gravity happen. Just breathe it out. It'll slowly get better. And then all you do is take your medicine straight away. After 10 minutes, when the edge is worn off, put your strap back on and you're good to go. And that is my biggest tip for morning boob. And I really haven't had that much pain to do with it. When I did wake up at 2:30 in the morning, I found that I was so uncomfortable sleeping on a 45-degree angle. I normally sleep on my back as it is, so I just decided to lay right down. I thought, I'd prefer to get some good rest rather than be restless. And I knew I was going to pay for it in the morning, but that's how I dealt with it. I took the strap off, got my partner to lift me up. It's slouched over a little bit so my boobs could, get the full gravity. Took my Panadol and my Valium, and 10 minutes later I was bright as rain. So that was basically my day of surgery and the sleep to the next morning. So what I'll do is I'll do another video about my day 1 post-op. See you then.